Hello, everyone. Thank you for joining us for this video from the Parkway Center to learn more about the topic of health literacy. I'm going to be sharing some information with you that was put together by the Parkway Center's Wellness Coordinator, Debbie Zampardi. I'm going to be talking about a new workshop being offered through the Parkway Center called Good Questions for Good Health, Talking to Your Healthcare Provider. This was developed by the Health Literacy Planning Team of Oneida County. So what is health literacy? Health literacy is a patient's ability to obtain, understand, and act on health information. But it's also a provider's capacity to communicate clearly, educate about health, and empower their patients. Health literacy is basically how to better understand and ask questions when you receive information from your healthcare provider. Whether it is a doctor, a nurse, a physician's assistant, a dentist, or anyone else associated with providing you with information about your health. This is not just about being able to read, write, or even understand English. It's about understanding what the doctor is talking about, or even to get answers to questions. Our overall goal and focus is to do what is necessary for every individual to be able to understand and do what is needed for healthier improvements. So why aren't healthy outcomes always happening? It's because we are at risk, which begs the question, why are we at risk? As many of you know, the healthcare industry relies heavily on the written word for their health communication with their patients. This could be numerous pages of information, even with prescriptions, and sometimes it's just hard to read through everything. And the healthcare system is not getting easier. There are more medications, testing, and procedures. Patients are given more options, and they're expected to be able to choose what's best for them. Many people are also likely to be going through more than one issue at a time. You might have a chronic ongoing condition that is worsening, or maybe you have a visual or hearing impairment. You could also be having issues with situational literacy, which is when a person is shutting down with emotions or having anxiety over recent news, and this can be a problem. Or there could be issues with cognitive burden. And this is when a person is overwhelmed with things going on in their life or with paperwork like you might have to fill out for insurance. Many people, for a variety of reasons, do not always have a clear understanding of what is going on, what they need to do or not do, and what their next steps are. If you feel this way, know that you are not alone. So why is having this workshop now so important, and what does it have to do with you? Well, we're going to hear from Kelly Walters, the Parkway Center Executive Director, and Joanne Rooney, the Parkway Center's Activities Coordinator, on problems that they have had navigating the healthcare system on behalf of loved ones.
Hi, my name is Kelly Walters, and I'm the Executive Director for the Parkway Center. During the corona epidemic, it has never been more important to understand how to ask your doctors about medical care, because family and caregivers are restricted from hospitals and nursing homes. And hospitals are now short-staffed because of the economic impact. Recently, my father-in-law had been in the hospital and we were not allowed to visit. My poor mother-in-law thought she would get regular updates on his care, but that wasn't the case. In order to receive updates, we've had to depend on what he's telling us versus actually what is being said by the doctors. For many of us, it helps to have a second set of ears listening to a doctor, because sometimes while in a situation of understanding the medical jargon and our own health, we may not hear the recommendations or the diagnosis in a way that we truly can understand, especially when, we don't feel good. We've learned from this experience that it is more than acceptable to call the nurse's station to get updates and request the doctor to call while they're doing the evaluations and talking about the care so that we can make more informed decisions from afar. It also helps to write down questions so that when you go to talk to a doctor, you don't forget what you wanted to know. The biggest advocate for your health care is you or your family and caregiver.
Hi, my name is Joanne, and I work at the Parkway. I'm the activities chairman there. However, I have experienced a lot with health with my husband. Um, Reiterating what Kelly said about an advocate, you definitely need an advocate when someone is sick. The individual doesn't really listen to anything that they hear, and they go home and they ask you all these different questions. Now, I went with him to every meeting, and I noticed different times that when his foot was dark, that he was getting gangrene. The doctor never said nothing about it. You have to watch yourself, and you have to get him interested in it because he thinks it's going to heal, and it's not going to heal. So I talked to the doctor every time I went in, and then I would ask the nurses the same thing. Could you tell me exactly what we have to do with him? Then I also got another doctor. I went to Cooperstown because I felt that I needed a second opinion. Don't hesitate second opinions because not all doctors know everything, just like we don't. But we have to watch it very carefully and know what's happening. He lost most of his toes, but I did keep him alive for 2 years after he got the gangrene. So I'm just telling you, please have an advocate with you or have another family member with you to go when you go.
So, why are we offering our workshop, Good Questions for Good Health, now? Because as you've just heard, the situation many of us are facing in the community, especially during this time when doctors and nurses have other priorities, is causing a lot of issues. This is a difficult time, and in this workshop, we're going to cover what risks you might be facing, how you plan for your appointment, why questions are the answer, how you can discuss sensitive topics, and some tips to make sure you understand what you're being told. Now, this workshop is going to be held on Zoom. It will be live and interactive, so we will all be able to see and hear each other. If you're not familiar with Zoom, we do have a short video on our YouTube channel that could be helpful. And we are also here to help you. So you can give us a call to sign up for the workshop or to ask questions on how to use Zoom. And you can still reach us at 315-223-3973. And we hope to see you at our workshop on Thursday, July 9th and or Thursday, July 30th from 1 to 2 p.m. Thank you so much.